Have you ever woken up in the morning and noticed a bitter taste in your mouth? Or perhaps you're currently experiencing this right now. Generally, this isn't anything to worry about and could be easily explained by something simple like dehydration. However, there are several diseases that can cause a bitter taste in the mouth, which often leaves a person feeling disgusted by the taste. So today, we'll be looking at 6 of these conditions and how you can treat them. 1. Dehydration. If your mouth tastes bad, the first thing you should check is your hydration level. One of the most common causes of bad breath is not drinking enough fluids. This problem tends to worsen with age, not just because of the body's weakened response to thirst, but also due to increased water loss as a natural byproduct of the aging process. 2. Oral health issues. Poor oral hygiene can lead to an unpleasant bitter taste in the mouth. This can be a sign of several issues, such as severe tooth decay, infections, abscesses, and even oral cancer. Many people delay dental treatment due to its high cost, but regular visits to the dentist are crucial for maintaining good oral health. Good oral hygiene is just as important. Failing to properly brush and floss your teeth allows plaque and bacteria to accumulate in your mouth, which can cause a bad taste. So, make sure to brush your teeth at least twice a day and floss at least once a day. 3. Nasal congestion. Whether you're suffering from sinusitis, seasonal allergies, a cold, or COVID-19, nasal congestion can negatively affect your sense of taste. This is partly due to inflammation and partly because your sense of smell plays a big role in how you perceive flavors. Nasal congestion becomes especially problematic if it forces you to breathe through your mouth instead of your nose. Mouth breathing dries out the tongue and mouth, which worsens the bitter taste. Strangely enough, antihistamines and decongestants can also cause this unpleasant taste. 4. Acid reflux, GERD. If you've ever experienced heartburn, you know it can leave a bad taste in your mouth. It can often be managed at home with over-the-counter antacids, along with minor changes to your diet, meal timing, and eating habits. Avoid eating meals right before lying down. The more bloated your stomach is, the more likely stomach acid will reach your esophagus and mouth. You can also elevate the head of your bed by placing it on books or blocks, around 10 to 15 centimeters. That way, gravity becomes your friend instead of your enemy. If you can't adjust your bed, try using a wedge pillow. If you suffer from regular heartburn, consult your doctor. You may have gastroesophageal reflux disease, GERD, which requires more comprehensive treatment than occasional heartburn. 5. Hormonal changes. When estrogen or progesterone levels fluctuate, it can affect your taste sensitivity and the turnover rate of your taste buds. As a result, pregnancy and menopause may sometimes be accompanied by an unpleasant sense of nausea or bitterness. And 6. Aging. As you get older, your sense of taste and smell change, as does your thirst mechanism. To make matters worse, the water content in your body also decreases, making dehydration more likely than ever. Depending on the cause, you may be able to reduce the bitter taste in your mouth by drinking more water, chewing sugar-free gum, trying a baking soda mouth rinse, or sucking on ice chips. If you found this video helpful, please share it with your friends and family. Until next time, stay healthy.